Leg cramps that wake you at 3 in the morning are not just age catching up with you. And if there's a magnesium bottle sitting on your nightstand right now, and it hasn't changed a thing, there's a reason no one has explained to you. You know the feeling. You're asleep, deep asleep, and then it hits. A knot so tight in your calf that you can't move, can't breathe through it, can't think about anything else. You grab the leg, you try to flex the foot, and by the time it finally lets go, you're wide awake. Heart pounding, staring at the ceiling. And here's what's worse. You've done what you were told. You drink water. You stretch before bed. You bought the magnesium. You take it every night. And the cramps keep coming. Most seniors are told night leg cramps are either dehydration or stiffness, or just something that happens as you get older. Something you learn to live with. However, and this is what changed everything I thought I knew, data from the National Health and Nutrition Examination Survey, analyzed by the NIH, found that 48% of Americans don't consume enough magnesium to meet even the estimated average requirement. And adults over 71 are the most likely group in the country to fall short. That's not a small number. That's nearly half the population. And for seniors, the gap is even wider. Not because you're eating badly, but because after 60, your body changes the rules, and nobody updates the instructions. My name is Dr. David Collin, and this is what I do. I look at the research that sits buried in medical journals. The research your doctor may not have time to walk you through in a 12-minute appointment, and I bring it here. Because after 60, everything changes, and most people aren't told why. Now, before I go any further, this is for educational purposes only. Always discuss changes with your own doctor. What I'm sharing today comes from named institutions, peer-reviewed research, and government health data. But your body is yours. Your doctor knows your history. I'm here to give you the information. They're there to help you act on it safely. If this kind of conversation matters to you, and I think it will, the easiest way to make sure you don't miss the next one is to subscribe. I cover things here that most seniors are never told. So here's what we're going to do in this conversation. By the time I'm done, you'll understand exactly why magnesium may be at the center of your night leg cramps, and why the obvious solution, the one sitting in that bottle, may not be reaching the muscle the way you think it is. You'll know which hidden drains are pulling magnesium out of your system without anyone telling you. And you'll know what steps actually matter, starting today. The enemy here isn't one person. It isn't one company. It's an outdated framework. A set of assumptions built decades ago that still treats night leg cramps like a harmless aging nuisance, like something you manage with a glass of water and a good stretch. That framework ignores what the nutrition science now shows about magnesium depletion, medication-related mineral loss, and absorption changes that happen specifically after 60. The system isn't hiding this from you on purpose. The information just never caught up. But you deserve the update. And that's why I'm here. Let me show you what's actually happening inside your body when that cramp hits. Magnesium. Think of it like the off switch for your muscles. Every time a muscle in your calf fires, every step, every shift in your sleep, calcium floods into the muscle cell and tells it to contract, to tighten. That's normal. That's how movement works. But then magnesium steps in and pushes that calcium back out. It tells the muscle, you're done. Let go. Relax. When magnesium is there, the cycle works. Fire, release, fire, release. When it's not, the muscle fires and keeps firing. The calcium floods in and nothing tells it to stop. That's not stiffness. That's not a pulled muscle. That is a cramp. That is what's happening at 3 in the morning. Now here's where age comes in. And I need you to listen to this carefully. The NIH Office of Dietary Supplements. This is the government's own fact sheet, updated in January of 2026, states it plainly. Older adults have lower dietary intakes of magnesium than younger adults. Magnesium absorption from the gut decreases with age. And renal magnesium excretion, the amount your kidneys flush out, increases with age. 3 hits at once. You're taking in less. You're absorbing less of what you take in. And your kidneys are letting more of it go. That's not a lifestyle problem. That's a biological shift. And it starts quietly, without a single symptom you'd notice, until the cramp shows up. And it gets worse. A 2021 peer-reviewed review published in the journal Nutrients confirmed that NAN's 3 data shows aging itself is an additional risk factor for inadequate magnesium consumption, with a progressive decrease over time. They also identified that reduced vitamin D levels, which are extremely common in older adults, further impair your intestinal magnesium absorption. So the gut that's already absorbing less is absorbing even less because vitamin D isn't there to help it. Lower intake, lower absorption, higher loss. Three forces pulling in the same direction. And nobody sat you down and connected those dots. Most seniors never connect this to that. Today you will. But there's still a question you should be asking. If this is about magnesium getting lower with age, then why doesn't the magnesium supplement just fix it? You bought the bottle. You take it every night. Why are the cramps still coming? This is where it gets personal. Because the answer isn't the same for everyone. And that's exactly the part that gets left out. Have you ever noticed the cramp comes after a day where you thought you did everything right? You drank your water. You had a decent dinner. You took the magnesium. And the cramp still showed up. Like clockwork. After midnight. There's a reason it hits at night. During the day, you're moving. You're eating. You're drinking. Your muscles are firing and releasing in short, normal cycles. But at night, you lie still for hours. The muscles cool. The circulation slows. And if magnesium levels in that muscle are even slightly low, that's when the threshold drops. That's when the calcium doesn't get pushed back out. That's when the cramp locks in. It's not random. It's timing. Your body runs its tightest mineral margins at the end of the day. And if you didn't put enough magnesium into the system at the right time, the deficit shows up in the dark. Now let me take you one level deeper. Because here's where most of the advice you've been given starts to fall apart. There's a category of medication that millions of seniors take every single day. You may be taking one right now. It's prescribed for acid reflux, heartburn, GERD. They're called proton pump inhibitors, PPIs. Drugs like omeprazole, esomeprazole, lansoprazole. Familiar names, familiar bottles. In 2011, the FDA, the United States Food and Drug Administration, issued a formal drug safety communication. It stated that long-term use of proton pump inhibitors can be associated with low magnesium levels, hypomagnesemia. And here's the part that stopped me. In 25% of the cases the FDA reviewed, magnesium supplements did not raise the levels back up. The patients had to stop the PPI entirely. The bottle is not the whole story. Think about what that means. A senior is taking magnesium every night for leg cramps. The cramps don't stop. They blame the supplement. They blame their age. They blame their body. But the real issue may be a reflux pill they've been on for years, quietly draining magnesium faster than the supplement can replace it. And no one connects the two. It doesn't end there. The NIH's own fact sheet confirms that chronic treatment with loop diuretics, like furosemide, which some of you know as Lasix, and thiazide diuretics, like hydrochlorothiazide, can increase urinary magnesium loss and lead to magnesium depletion. These are water pills, prescribed for blood pressure, prescribed for swelling, prescribed to millions of Americans over 60. And here's what the research also shows. Diuretic-related magnesium loss often comes alongside potassium loss. A peer-reviewed review in the journal Nutrients in 2021 confirmed that hypomagnesemia is present in approximately 40% of patients who also have hypokalemia, low potassium. The two minerals fall together. And when both are low, the muscle becomes more irritable, the nerve signals become harder to regulate, and the cramps get worse. Not just in frequency, in intensity. That matters tonight. So let me ask you something. How many of you are taking a reflux medication and a magnesium supplement and still waking up in pain? How many of you are on a water pill for blood pressure and nobody ever mentioned what that pill might be doing to the magnesium your muscles need? This is not age. This is something your body is doing, and we can fix it. But there's another hidden problem, and this one affects every senior, whether they're on medications or not. It's about the blood test, the one your doctor orders when they check your levels. Serum magnesium, the standard blood test, measures the magnesium floating in your blood. Less than 1% of your total body magnesium is in your blood. Less than 1%. A peer-reviewed paper published in Open Heart, a BMJ journal, in 2018 by Dina Colantonio and colleagues stated it directly. Serum magnesium does not reflect intracellular magnesium. And over 99% of your total body magnesium is intracellular, inside the cells, inside the bones, inside the muscle tissue, not in the blood. So your doctor checks your serum magnesium. It comes back normal. You both breathe a sigh of relief. But inside the muscle, where the cramp is actually happening, the magnesium may already be depleted, and the blood test never caught it. I need you to think about your own pattern. The cramps that keep returning. The supplement that should be working. The blood test that said everything was fine. Put those three things together. Your doctor never told you this, but I will. I want you to drop a letter in the comments right now. If you still believe your night leg cramps are mostly about dehydration or just getting older, drop the letter A. If you believe magnesium loss, medication effects, and mineral balance may be the real issue, drop the letter B. I read every single comment personally. Let me know below. And now here is the part I've been building toward. Everything I've told you so far is real, and it matters. But there's something that changes all of it, something almost no one talks about. And once you understand it, you'll never look at that magnesium bottle the same way again. After 60, the problem with night leg cramps is often not simply that you don't have enough magnesium. It's deeper than that. It's a magnesium delivery failure. Let me explain what I mean. A senior may be taking magnesium every night, but the magnesium they trust never reaches the muscle in the way they expect. Not because the supplement is fake, not because they're doing something wrong on purpose, but because the delivery chain is broken at one or more points, and nobody showed them where. Point 1. The intake itself may be too low from food. Most seniors eat lighter dinners as they age. Smaller portions. Fewer of the magnesium-dense foods. The NIH fact sheet lists the top food sources. Pumpkin seeds at 156 milligrams per ounce. Almonds at 80 milligrams. Boiled spinach at 78 milligrams per half cup. Black beans at 60. A baked potato at 43. Plain yogurt at 42. How many of those showed up on your plate this week? Point 2. Absorption. Even if the food or supplement enters your system, your gut may not absorb it efficiently anymore. The NIH confirms that intestinal magnesium absorption decreases with age. If vitamin D is low, and it often is, that absorption drops further. So the magnesium goes in, but not enough of it crosses the gut wall and gets into the blood. Point 3. Loss. Even if the magnesium gets absorbed, your kidneys may be flushing more of it than they should, especially if you're on a diuretic. Or a PPI may be interfering with the absorption pathway itself. So the magnesium enters the body, but it leaves before the muscle ever gets to use it. Point 4. The wrong form. Not all magnesium supplements are absorbed equally. The NIH's own fact sheet states that magnesium oxide and magnesium sulfate have lower bioavailability than magnesium citrate, magnesium chloride, or magnesium lactate. If the bottle on your nightstand is magnesium oxide, which is one of the most common and cheapest forms on the shelf, your body may be absorbing a fraction of what's on the label. Wrong form, wrong timing, wrong assumption. What if the magnesium is present, but your body can't hold on to it? What if the delivery chain has been quietly breaking down at 2 or 3 points for years? That is the magnesium delivery failure. And that is why one senior takes magnesium and feels better in a week, while another takes the same bottle for 6 months and nothing changes. Most seniors never get this far. They manage one piece of the puzzle, but they miss the delivery failure. And that gap is exactly what keeps the problem returning. I'm telling you this because nobody else in this space will. So now let's talk about what you can actually do with everything you've just learned. The Cochrane database of systematic reviews. This is considered the gold standard for evaluating medical evidence. Published an updated review in 2020 by Garrison and colleagues. They looked at 11 trials, 735 participants. And for idiopathic leg cramps in older adults, they found that magnesium supplementation alone was unlikely to provide clinically meaningful cramp relief. Now, before you throw that bottle away, that's not the whole picture. What the Cochrane review tells us is not that magnesium doesn't matter. It tells us that taking a magnesium pill without understanding the context is not enough. The pill alone, without identifying the hidden losses, without correcting the food gap, without checking what medications might be working against it, that's where the approach fails. So here's what matters. And I want you to listen to this part slowly, because this is the protocol, the real one, the one I'd walk through with my own family. The first step is to identify your hidden magnesium loss pattern. Are you on a proton pump inhibitor for reflux? A loop diuretic or a thiazide for blood pressure? Are you taking a laxative regularly? Do you have digestive issues that could affect absorption? Any one of these can be quietly pulling magnesium out of your system faster than food or supplements can replace it. Write these down. Bring them to your next doctor's visit. Ask specifically, could any of my medications be affecting my magnesium levels? The second step is a food-first magnesium strategy. Not random, not guessing, consistent. The USDA Food Data Central database gives us exact numbers. 1 ounce of pumpkin seeds, that's a small handful, delivers 156 milligrams of magnesium. A half cup of cooked spinach gives you 78. An ounce of almonds gives 80. A half cup of black beans, 60. A baked potato with the skin, 43. Plain yogurt, 42 milligrams per 8 ounces. You don't need to eat all of these every day, but you need at least 2 or 3 of them showing up consistently, especially at dinner. Because the magnesium you eat in the evening is the magnesium your muscles rely on overnight. If dinner is light and low in these foods, your body enters the night already running short. And that's when the cramp finds its window. The third step, and this one I say with real care, is to review any supplement changes with your doctor. Especially if you have kidney concerns, if you're on prescription medications, or if the cramps have been persistent despite everything you've tried. This is for educational purposes only. Always discuss changes with your own doctor. If you have chronic kidney disease, if you're on dialysis, if your kidney function has been flagged at any point, magnesium supplementation without medical supervision can be risky. The kidneys are what regulate magnesium excretion. When they're compromised, magnesium can build up instead of clearing. That's a different kind of danger. And it's why guessing is never the right move. If your doctor does support a magnesium supplement, ask about the form. Citrate, chloride, lactate, these tend to be better absorbed than magnesium oxide, according to NIH research. And ask about timing. Taking magnesium with an evening meal alongside food generally supports absorption better than taking it on an empty stomach. So to be clear, the magnesium bottle isn't the enemy. But the bottle without the context? That's where most seniors get stuck. It's not about more magnesium. It's about making sure the magnesium actually reaches the muscle, and that nothing in your system is quietly canceling it out. This is not age. This is something your body is doing, and once you see the pattern, you can work with your doctor to change it. Let me put it plainly. Night leg cramps after 60 are not a message to surrender. They are a signal to check magnesium loss, to check absorption, to check mineral balance, intelligently, with your doctor's guidance, with real food in the equation, with the hidden drains identified and addressed. Most seniors never connect this to that. Now you have. Before I let you go, there's one more thing, and this might be the most important part of everything I've said today. Guessing with magnesium is not a harmless experiment for every senior. If you're on a reflux medication, if you're on a water pill, if your kidneys aren't at full capacity, if you're taking a blood pressure drug that interacts with mineral balance, changing your magnesium intake without a conversation with your doctor could create a new problem while you're trying to solve the old one. The goal is clarity, not more confusion. Night leg cramps are a signal, not a sentence. Now you know what the signal may be pointing to. But now that you understand magnesium, the loss, the absorption, the delivery failure, there's another piece. Because even when magnesium is handled correctly, there are 7 common supplement mistakes that can silently cancel everything out. Wrong form, wrong timing, wrong combination. And most seniors are making at least 2 of them right now without knowing it. If you don't address those mistakes, the cramps often come back. I cover exactly that in the next video. Watch it now.